Hey guys, today we're talking about degenerative disc disease of the neck, which is really just a medical terminology for wear and tear of the neck or damage to the spine at the neck. It's a common contributor to neck pain and other symptoms near the neck and shoulders. So if you have neck pain or know someone that does, stick around. Guys, this is Dr. Moore with Cumberland Chiropractic and Sports Medicine. So again, we're talking about wear and tear of the neck or degenerative disc disease. So why would you develop degenerative disc disease in the neck in the first place? Some things that cause this are: one, normal aging. By the age of about 50 or 60 years old, most of us have what would be called degenerative disc disease in the neck at some region or another, just part of normal aging. Another reason why you might develop this is if you had an injury, like you fell on your neck, you had twisted or damaged the joints in the neck in some way or another, maybe like a car crash. And then what's probably the most common reason for this to develop is chronic wear and tear brought on by poor posture or poor ergonomics. Let's say you have a desk job. If you sit in a way kind of long term that puts a lot of stress at your neck, then you'll develop degenerative disc disease sooner than others. So my visual representation of what this looks like, if you can see these two models here, this one in my right hand, this is the representation of a normal segment in the spine. What you look for is a healthy joint space, so the disc in between the two segments of bone here needs to be uniform if you're looking at it on an x-ray compared to the rest, and the edges here, you can see they're clean. This, on the other hand, would be a representation of what begins to look like degenerative disc disease. So comparing the two, you have a loss of disc height, and then you're starting to see some bony formations here on the side. They call those bone spurs on an x-ray, and that's what the spine will begin to look like on an x-ray with degenerative disc disease. Okay, so this wear and tear at the neck typically presents with pain. Another problem with it is, if left unattended for long enough, this degeneration that you start to see in your spine, the bone spurring, it'll cause a loss of range of motion. You'll notice like clicking in your neck when you go to turn it and look from side to side. If left unattended, you'll start to see that loss of disc height in between the segments of your spine, and it'll start to irritate the nerves that leave the spine and go down your shoulder and your arm. So you'll have radiating pain into your neck or your shoulder, your arm. So what do we do to treat this issue, to stave off that wear and tear in your neck, to leave you with a healthy spine into your old age? Well, we have to eliminate what it is that's causing that overcompression or that wear and tear at that segment. If it's a compression at your neck, maybe a tightness in the musculature of your neck or your shoulder that's restricting your neck, then we can treat that with muscle work or stretching or rehabilitative exercises. If it is a joint restriction, maybe there's a joint in your neck that isn't moving the way that it should, causing some wear and tear, then we can obviously adjust that with chiropractic adjusting of those joints. And then if it's something long-term, like an ergonomic problem, maybe you have a desk job or something and you're not sitting or standing quite right, and it's causing more pressure at one segment of your neck, then we need to address that with either ergonomic training, like I said, stretching, strengthening of certain muscles that have become unbalanced in one way or another. It really just depends on a case-by-case basis. So if you have neck pain or you know somebody that does, please share this video with them. It's good knowledge to have. If you like this video, please give it the thumbs up. And then if you have any questions or comments about this condition, please leave it with the video. This has been Dr. Moore with Cumberland Chiropractic and Sports Medicine, where we get you better, faster.